Have you ever wondered how pediatric physical therapy can help a child meet their developmental milestones? Hi, I'm Dr. Jessica Leland, pediatric physical therapist and founder of Wobbly Beginnings. I specialize in helping infants and toddlers feel good in their bodies and meet key developmental milestones so that they gain the confidence to move, play, and thrive. You can find more information at wobblybeginnings.com. In today's video, I'm going to talk about what is pediatric physical therapy, who it's for, and how it can benefit your child. So let's dive in. As physical therapists, we specialize in movement, motor development, and body function. We look at things such as mobility, strength and endurance, muscle, fascial, and joint function, coordination, postural alignment and balance, oral motor skills, sensory and neuromotor development. As pediatric physical therapists, we work closely with children and their families to help a child meet their maximum potential for independent function and to promote participation in home, school, and community environments. As physical therapists, we are helping those children to gain strength, balance, and coordination to help with their mobility, to gain access to their environment. We recognize that every child is unique, and so therapy has to be tailored to meet each child's specific needs at various stages of development. We are often conducting an interview or a conversation at the beginning to help identify those child's needs and to determine what are the family's goals. We perform an examination and evaluation to help us gain information about how the child's body is functioning. We use all that information to develop an assessment and then to go forward with a goal-directed plan of care. And all of this is coming from a family-centered approach where we really are taking into consideration what are the child's needs and what are the family's goals. And how can we help support that? We help a spectrum of kids at various ages and various different developmental levels. We can help babies who have body tension that might be impacting their ability to feed or their overall movement for early developmental milestones. We help children who are having difficulties meeting their developmental milestones. Maybe they're not crawling and others are. Maybe they're having a hard time walking. Maybe they're really struggling with their higher level gross motor skills, such as running, jumping, galloping, skipping, riding a bike. We're going to look at how is their body function and how is their motor development and how can we support that. We work with children that face challenges and balance, coordination, and strength that can make play participation limited. Maybe those make challenging access to a playground. We also help children who are recovering from injuries, fractures, or surgeries to restore mobility and function following those episodes. We also work with children who have conditions that require more specialized support, such as cerebral palsy, Down syndrome, spina bifida, muscular dystrophy. We work with other conditions such as hip dysplasia, torticollis, clubfoot, hypotonia, also known as low muscle tone, and toe walking. And at each stage, we are going to look at the child in front of us and say, how can we help? What are we seeing? And where are we trying to go? A child that is taking part in pediatric physical therapy can have the benefit of gaining improved body tension. We can release muscle and fascial tension, which can then help to improve postural alignment. Once we have better postural alignment, we can work on building strength and endurance within that postural alignment. We then tie that into our motor skills, and we're going to try to learn a motor skill that maybe we don't have, or maybe that has been struggling for us. Maybe we need to continue to work on boosting our balance and challenging our balance systems so that we can be safe when we are on stable and unstable surfaces, or we can be safe when we are climbing or engaging in play at a playground. We are going to support the family throughout this entire process. Pediatric physical therapy really encompasses the child and their family, and family support is key. We may provide this family with education, with resources. We are going to find a way to give the family possibly ways to help their child at home to carry over what we may be doing in our sessions. The ultimate goal of pediatric physical therapy is to enhance the independence and confidence of the child so that we can improve their quality of life and the quality of life of their family. Pediatric physical therapy plays a critical role in supporting a child's physical development. Whether your infant or toddler is working through body tension, working towards achieving new gross motor milestones, recovering from an injury, or managing a condition, therapy provides a family-centered approach to maximize the child's independent function and participation. At Wobbly Beginnings, we like to think of therapy process as helping children to sprout roots for endless potential. By nurturing their early development, we're establishing a strong foundation for growth. Through pediatric physical therapy, we can guide their journey and foster their strength and confidence and mobility that will empower them to flourish at every stage of life. If you think your child could benefit from pediatric physical therapy, visit us at wobblybeginnings.com to find out more information and get in touch with us.